Hi, I'm Dr. John Coolican. I'm here with my patient Ellen. In 2021, Ellen came to my office asking for help with her current dental condition. So in a moment, I'd like to turn this over to Ellen and have her describe her condition. Good afternoon, Ellen. Thanks for being here.
Good afternoon. I'm happy to be here and tell you everybody how great mini dental implants are. I had a bad experience with dentures. I had to have top and bottom dentures, which they said would be just like regular teeth, but they weren't because I couldn't eat half of it. I'm a foodie, I love to eat. I couldn't eat half the stuff that I wanted to. So I was just, they never really fit right. You know, they were like loose, they looked like I had dentures in my mouth. And just the process of every morning getting up and having to put them in your mouth, you know, and gagging, putting them in, and terrible. And finally, we saw your infomercial on TV, and my husband said, let's go, and it won't hurt to talk to the guy. So we went, and immediately I love Dr. Coolican because he's a very nice man. And I got the roundhouse, the upper and lower permanent mini dental implants. And my life has been great since.
Right. So that was in 2021, so that was 3 years ago.
Yes.
And how have things been? As your expectation is everything that you thought it would be?
Everything and more.
Terrific.
I get so many compliments. It's just the quality of life. You know, I'm a retired teacher. You know, what do? You go out with your old friends that you taught with. And I hated even to go out for lunch or do anything because I was so self-conscious about my teeth. I was afraid that the dentures, that they were gonna fall, whatever. But now, with this permanent solution, I don't have to worry about that.
And now what do you have to do every day to maintain your permanent teeth?
Well, you brush your teeth like always, but then you use a water pick. And it's very simple. You know, you get a water pick and you go on the top, underneath, the bottom, and underneath. And you still go and get a cleaning every 6 months is recommended. And then you come back and see Dr. Coolican once a year. And everything's great. Life is good again because of Dr. John Coolican.
Terrific. Thanks, Ellen.